Hey, thank you so much for joining the Easy Medicare class, where you're going to find out if you need to enroll into Medicare in just under 20 minutes without leaving your home. It's going to be super fast, super easy, and the best part is there's no lines. You don't have to wait in line at a Social Security office. You don't have to sit in a seminar. We're going to make this super quick and easy for you. My name is Victoria Cabrera. I will be your host. I am the owner of the Insurance Space. We are a local Medicare insurance agency. So let's get into it. So I want to explain this little red, white, and blue card. So when you turn 65 and you plan on enrolling into Medicare, or you're going to be enrolling into Medicare for the very first time because now you're retiring, you're going to get this little red, white, and blue card. Or when you do enroll, you're going to see this red, white, and blue card. And what happens is Medicare breaks it up into two parts. So you have what's called Part A, which is going to be the hospital portion, and you have Part B, which is the medical portion. So we're going to get into what this little red, white, and blue card is, and then we're going to go over briefly all of your different options when you get this red, white, and blue card. We're also going to go over whether or not you should enroll. So let's explain this red, white, and blue card here for a second. The Part A is specifically for hospital. The hospital coverage is going to be anything within the four walls of a hospital room. Okay, so there is no cost for that portion as long as you had 40 quarters and you paid into the tax system for those 40 quarters, or 10 years. So the hospital portion does not have a monthly cost involved. However, there is a deductible starting in 2025 of $1,676. Keep in mind, this is not an annual deductible. This is a per benefit period deductible. So that means that there is a possibility that you can pay that again if you were to be hospitalized multiple times in the year, depending when and how that happened. So again, the Part A is only the hospital portion. Part B is the medical portion. This is the most popular part. This is probably where most of you will get most of your care. This will be doctors. This will be any type of office visits, durable medical equipment, just about anything that is not Part A, which is hospital. Now, the Part B on the medical portion does have a monthly cost involved. That cost is $185 per month. Now, this is the standard Part B premium based off of 2025, the year 2025, and that can increase based off of your income. So if you are a higher income earner, and let's say you withdrew from a 401k or IRA, or maybe you just make quite a bit of income, this cost can go up. Now, if on the other side of that, if you're a low income earner, then there's a possibility that the state can come in and help you pay that monthly cost. However, there is no way around it. That Part B premium, you will, if you have Part B, you will pay that premium unless you are of lower income. Now, there is a separate annual deductible for Part B of $257 as of 2025. If you do not pick up the Part B when you're supposed to, and you do not have credible coverage, you will have a 10% late enrollment penalty for every 12 months you go without it. So if you're the type of person that says, I don't need it, I don't want it, and you don't have any coverage, you may be on the hook for a late enrollment penalty, and that is a lifetime penalty for as long as you have Medicare. Now, you may have heard of the 80-20 coinsurance with Medicare. So the good news is Medicare does pay 80% of your Part B services, and then you are on the hook for 20%. Now, the bad news here is that Medicare does not have what's called a stop loss. There's no limit to the amount that you will pay on your Part B covered services. So let's pretend that you only have the Medicare card, which is the red, white, and blue card, which is what we're looking at right here. Let's pretend that you don't have anything else like a Medicare supplement or Medicare Advantage. if you do have $100,000 worth of Part B cost or Part B services that were under Part B, then you are on the hook for $20,000. There is no maximum out of pocket when it comes to original Medicare. Now let's talk about the drug coverage, because the drug coverage is actually not covered on this red, white, and blue card. The drug coverage you actually have to purchase separately. Now there was quite a bit of changes that happened with the Inflation Reduction Act that impacted some of the way the drugs are charged to you. However, if you do not pick up a separate drug card, or you do not have drug coverage included in your plan, your Medicare plan, or your existing plan that you have, you will be on the hook for a 1% monthly late enrollment penalty when you do decide to pick up the Part D, which is D as in drugs. So let's move on to the options that you have for Medicare. Now, as we went over before, we went over the Medicare card itself and how Medicare is covered. So there's really only 4 options when you do pick up original Medicare. So I'm only talking to the people that decide you have the red, white, and blue card, you decided to enroll into Medicare. If you're still on the fence, we'll go over that here in a second. But for those of you that absolutely know you have to pick up the Part B, let's go over your options, okay? So there is one option, which is option number 1, which is original Medicare. We never recommend just staying on original Medicare by itself. The reason why is you learn that if you keep just original Medicare by itself with nothing else, you're pretty much on the hook for 20% and the deductibles under Part A and Part B. With that said, those costs can get very expensive if you don't have other coverage in place. So we say no to that, okay? The next option, which would be option 2, which would be the same exact thing. The only thing is you would have that red, white, and blue card by itself. The only thing that would be different is that you picked up the drug portion. So in this case, it would be original Medicare with Part D. Again, this does not solve the problem of you paying 20% and the deductibles that Medicare charges. So we would say no to this one. So it's pretty simple here. No to option 1, no to option 2. So that leaves us with option 3 and option 4. In option 3, you can keep, in this option, you would have 3 cards. You would have your Medicare card. You would pick up a Medicare supplement, like a Plan G, a Plan N. Some of you maybe have a Plan F in place. And then you would pick up your drug portion. Now, we recommend this type of plan because it's probably going to be the most comprehensive coverage that you can possibly get when you enroll into Medicare. Now, another thing is that you cannot just enroll into this plan at any time. Once you have a 6-month window within your initial enrollment period, a 6-month window to get into a Medicare supplement with no health underwriting. What that means is that regardless of your health history, you can get a Medicare supplement, and they cannot ask you any health questions depending on the state that you're in. So we always highly recommend this option for people that can afford the monthly cost. So for example, in this option, you would have 3 monthly costs involved. You would have to pay your Medicare Part B premium. You would have to pick up a Medicare supplement through one of the hundreds of insurance companies out there. So that's an extra monthly cost. And then you would have to pay for your Part D, which is another monthly cost. So it can get close to that $250 over $300 range. That's not even including dental, vision, and all the other stuff that you need to add. So I would consider this option an a la carte option. But the beauty of a Medicare supplement is that you can go anywhere in the U.S. as long as that doctor or provider accepts original Medicare. You do not have to get referrals. And most of the time, all of your, so what's going to happen is the Medicare supplement will pick up where Medicare leaves off. Now, the best plan right now is going to be the Plan G. The only out-of-pocket cost that you would have with the Plan G would be your Part B deductible. As we stated above, it's $257. So if you think about it, $257 for all of your health care in 1 year is wonderful. Now, again, this is going to be for people that can stomach that monthly cost, which is close to that $300 range when you add it all together. Assuming you don't have any increases in your Part B premium. Now, so again, highly recommend the Medicare supplement, but for those individuals that are like Victoria, I want something that's all in one. I want to get a plan where it's more affordable, that it includes all of those extra benefits that you see on TV. Some of these may include extra benefits. In this option, if you cannot go with a Medicare supplement and you cannot stomach the extra cost because now you're on a fixed income, your next option would be a Medicare Advantage, a Part C plan. These are also known as all-in-one plans. You've seen them on TV. Get your, Part C with XYZ insurance company. That includes this benefit, that benefit. It includes, extra benefits that Medicare doesn't cover. It also includes drug coverage. So these plans are very good. Now, when we look at our clients, we have quite a bit of clients that are on Medicare supplement, and the other half are on Medicare Advantage, because we understand that it's not a one-size-fits-all. And although, in a perfect world, everyone that we would hope that we can get on a Medicare supplement, in a perfect world, half of our clients are actually on a Part C plan. Now, we never put anybody on a Medicare Advantage plan without additional coverages that we would recommend to cover those gaps in Medicare Advantage. The reason why is Medicare Advantage is a network-based plan. They come in an HMO, as you've probably seen before, and they also come in a PPO. Okay, so these are network-based plans, meaning that you have to be assigned a primary care doctor, and if you go to see a doctor or a hospital, you're paying co-pays. Okay, so you're paying co-pays for doctor visits, you're paying co-pays for hospital, you're paying co-pays for anesthesiology, you're paying co-pays for CT scans, MRIs. Basically, in this situation, it's a pay-as-you-go. Now, what's the beauty of these plans is there's typically, in most cases, no monthly cost involved. You would just have to pay your Part B premium. So as long as you continue to pay your Part B premium, there's no additional cost in most cases for these types of plans. And again, these plans typically come with those extra benefits that you would have to purchase on your own if you had a Medicare supplement. So again, Medicare Advantage is very popular for our seniors that are turning 65, especially those on a fixed income. So people always ask me, Victoria, what is the best way to go? And there's never one answer. It's always just based on your situation. So there is a chance that you may end up going one way or another. We won't know that until we have a real conversation about your situation. So let's get into who has to enroll into a Medicare. So should you sign up for Medicare? I went ahead and did this little quick chart here for people that I think should enroll into Medicare, absolutely. So if you fall into the left side, this is a yes, you should get Medicare. If you have ACA Marketplace, you cannot keep that ACA plan if you're eligible for any part of Medicare. So if you have an ACA through the Marketplace or healthcare.gov, you absolutely want to go ahead and start talking with us now so we can help you transition very easily from the Marketplace plan. And for those of you that get 100% subsidy where the government is helping you pay those premiums, it's going to be a little bit of a transition. I get it. But again, you are not allowed to keep that ACA plan if you're eligible for any part of Medicare. Okay. If you're leaving group insurance coverage. So if you're leaving group insurance coverage and you don't even have the option to stay on that coverage, well, again, you absolutely you don't have to enroll into Medicare. It's not a requirement. But it would almost be like you're leaving yourself uninsured. So obviously you would not want to not enroll. So in this case, you would want to enroll. If you're on a spouse's plan and that coverage, if your spouse's employer to have you on that coverage is far more expensive than what Medicare cost. And I'm telling you, almost 90% of the time we do find out that the coverage is way more expensive and not as good compared to Medicare. So these individuals, I would highly recommend, unless the employer is paying 100% of your spouse's premium, then you definitely want to get enrolled into Medicare. If you have no other coverage, you absolutely want to enroll into Medicare. If you have TRICARE for Life or CHAMP VA, you absolutely have to enroll into Medicare. There is no choice there. However, if you're on veterans benefits, VA only, I would highly recommend to book a call with us to see if it's necessary for you. We have a specific veteran class specifically for you because it's slightly different. So if you fall under veteran benefits only, please book an appointment below. So make sure you go ahead and click that button, book an appointment. It's a quick phone call, and we'll get you that veteran Medicare class. Now, who should consider maybe more? So in this column, we're talking to you. If you didn't meet any of these situations, maybe you should consider not enrolling, or maybe you're still on the fence. We would have to have a conversation. So for you, if you're still working and your employer pays 100% of your coverage, I would maybe consider staying depending on what that situation looks like and how the coverage looks. Okay. So again, this would still yield a conversation. Let's see if it makes 100% to stay on that group insurance coverage, and we can help you find that out. If you're self-employed and a high income earner, the reason why we say maybe consider is because if you're self-employed and have coverage through your own group insurance plan and you're a high income earner, this can increase your Part B premium. So we would definitely want to take a look to see what is less expensive and better for you. If you have a younger spouse, so your younger spouse is dependent upon your coverage, this is very common. So if you're still working and you turn 65, but your spouse is younger and they're dependent upon your coverage, then I would highly recommend considering maybe not enrolling. We have to look at your situation. Another situation would be living abroad. You're going to move out of the country and go live in Mexico or Cabo or wherever you're going to go for retirement. If you're living abroad, in most countries, they don't recognize Medicare. So that's something that we want to consider. Now, these are just the most popular situations. Obviously, there are more situations, but either way, we absolutely want to look at that. So let's look at the next steps. We need to find out if you absolutely must enroll into Medicare. So we let's have a quick conversation. It takes about maybe 10 to 15 minutes. It's not long. It's very informal. We'll want to find out if you have to enroll into Part A and Part B. Then we're going to want to determine if your employer sponsor plan is going to be more cost effective than Medicare. Don't rule out Medicare yet. Most of you probably just don't want to deal with it. I get it. It's a pain in the butt process, but we have to compare apples to apples to see if it makes sense. Another reason is let's see where you're at in the Medicare enrollment process. Are you 3 months away? It would make sense for you to start that process now because Social Security and Medicare get backed up, and last thing you want to do is rely on the government to speed things up. So let's get you on track. Let's see where you're at. Where are you in the enrollment process of Medicare? And we can help you with this. We help you we can help walk you through the online process or how to go about it going to your local Social Security office. We'll explain any penalties and if you're maybe overpaying for coverage that you may not need. A lot of people enroll into Medicare. They have their group insurance. They have a Medicare supplement, and we have to tell them, hey, you're way over covered. So let's take a look at that. If you're enrolling into Medicare A and B, we help you determine which route is best for you. Is it a Medicare Advantage? Is a Medicare supplement with a standalone card? We have to see what makes sense for you with your situation. Don't listen to your neighbors. Don't listen to your family. Although I'm sure they have the best interest at heart, it would make sense for you to speak with an expert like ourselves because we know Medicare. Okay, probably, unfortunately, we know Medicare more than your doctor sometimes. Definitely don't get advice from your doctor on Medicare stuff. And then you have to secure other coverages even if you don't plan on enrolling into Medicare. I see it happen time and time again where people don't enroll into Medicare and they forgot to secure the additional coverage like cancer, heart attack, and stroke, or even their final expense. Keep in mind, these coverages do look at your age, your health history. So you want to get these coverages and secure these coverages so when you do enroll into Medicare, you're covering all of those gaps that Medicare doesn't cover. So finally, I'm trying to keep it super quick and super simple. Schedule a quick phone call with us right now. Go ahead and click that button down below. By the way, we don't charge for our services. It's a no pressure zone, so we don't like pressure you into buying stuff like other agents are very, desperate to get your business. We are very educational based. We want to give you the right information so you can make the right decision and you feel comfortable and you feel at ease. So leave your wallet at home. Let's have a very informal chat. It's not through a Zoom call. It's literally just pick up your phone and let's have a quick chat. Just for booking today, we're going to send you 2 free bonus items. So go ahead and click that button down below. Schedule your appointment. We're going to send you our free Medicare Breakdown ebook. For those of you that like to read, I'm not a big reader, but we have a book. We'll send it over to you. And then your free Medicare Survival Kit, we can mail that to you. We also have our bonus items that we can send via, so if you don't want us to mail anything, we'll just send it to you to your email. It's a Medicare cost summary and a couple of other important things that you need when enrolling into Medicare. So why would you even want to consider booking an appointment with us? Because we're not a call center. We are a local insurance agency. I've been in the business for over 20 years. We represent both Medicare Advantage, Medicare Supplements. We're unbiased. We work for you, not the insurance companies. Although we do represent a ton of insurance companies out there. All the big ones that you see on TV, we represent. And the good news is that when you work with us, we don't charge you a fee for our service. You get lifetime support. If you enroll into a health plan, obviously we get paid by the insurance companies. There's no secret there. We have to make a living. But the good news is it does not impact your pricing. You will get access to the same price that you would get if you enrolled direct with Medicare.gov. So there's no benefit of you enrolling directly with Medicare.gov. Okay. Again, schedule that quick appointment. Talk to us. Text us. We're real people. We're not call center where you're never going to get the same person every time. Okay. So we look forward to chatting with you. Let's get this taken care of for you. You have nothing to really worry about. You don't have to bring your wallet or anything like that. So book that appointment and we'll talk to you soon.